Question number 1. The primitive streak originates from proliferation of. The right answer is A. Epiblast cells. Question number 2. The precaudal plate is derived from. The right answer is D. Endoderm and ectoderm. Question number 3. The intra-embryonic column forms during. The right answer is C. 4th week. Question number 4. The connecting stalk later develops into. The right answer is B. Umbilical cord. Question number 5. The extra-embryonic mesoderm originates from. The right answer is B. Epiblast-derived mesoderm. Question number 6. Formation of the neural crest occur during. The right answer is D. Primary neurulation. Question number 7. The chorionic villi become secondary villi when they contain. The right answer is B. Mesoderm core. Question number 8. The vitelline circulation connects diapside to. The right answer is A. Dorsal aorta. Question number 9. Semiodomers give rise mainly to. The right answer is D. Skeletal muscle of head. Question number 10. The amniotic cavity first appear within the. The right answer is C. Epiblast. Question number 11. The umbilical cord normally contains. The right answer is A. One vein, two arteries. Question number 12. The fetal adrenal cortex is derived from. The right answer is B. Mesoderm. Question number 30. Primary ossification centers appear post in. The right answer is A. Femur shaft. Question number 40. The foramen veil closes functionally at. The right answer is D. Birth. Question number 15. The yolk sac contributes to. The right answer is B. Blood cell formation. Question number 16. The chorion is formed from. The right answer is A. Cytotrophoblast and mesoderm. Question number 17. The fetal diaphragm is derived mainly from. The right answer is D. Septum transversum. Question number 80. The optic vesicle arises from. The right answer is A. Diencephala. Question number 90. The elendice develops during. The right answer is B. Week 3. Question number 20. The decidua bacillus contributes to. The right answer is D. Maternal placenta. Question number 21. The umbilical vein carries. The right answer is B. Oxygenated blood. Question number 42. Formation of the three germ layers occur in. The right answer is A. Gastrulation. Question number 23. The buccopharyngeal membrane disappear at. The right answer is B. Week 4. Question number 24. Meckel's diverticulum arises from persistence of. The right answer is A. Vitelline duct. Question number 25. First, branchial or cartilage is. The right answer is D. Meckel's cartilage. Question number 26. The conus medullaris in newborns in it. The right answer is B. L3. Question number 27. The fetal kidney develops from. The right answer is A. Mesonephros and metanephros. Question number 28. Ductus venosus connects. The right answer is A. Umbilical vein to IVC. Question number 29. The thyroid gland originates from. The right answer is B. Foramen cecum. Question number 30. The adrenal medulla develops from. The right answer is A. Neural crest. Question number 31. The lung buds arise from. The right answer is C. Foregut endoderm. Question number 32. The fetal skull base forms by. The right answer is D. Endochondral ossification. Question number 33. Primary fillet is formed from. The right answer is A. Intermaxillary segment. Question number 34. Cloaca divides into urogenital sinus and rectum by. The right answer is A. Urorectal septum. Question number 35. The most common site of ectopic pregnancy is. The right answer is B. Ampulla. Question number 36. The fetal period begins from. The right answer is A. 8th week. Question number 37. The sclerotome forms. The right answer is D. Vertebrae. Question number 38. Umbilical arteries are branches of. The right answer is C. Common iliac. Question number 39. The anterior pituitary develops from. The right answer is A. Raedke's pouch. Question number 4. The most critical period for teratogenic exposure is. The right answer is D. First trimester. Question number 41. Primitive gut tube is lined by. The right answer is A. Endoderm. Question number 42. Secondary oocyte completes meiosis to it. The right answer is B. Fertilization. Question number 43. The fetal liver is the main site of hematopoiesis during. The right answer is A. Second trimester. Question number 44. The umbilical cord is governed by. The right answer is C. Amnion. Question number 45. The main derivative of the third pharyngeal pouch is. The right answer is A. Thymus. Question number 46. Incomplete closure of anterior neurophore results in. The right answer is B. Anencephaly. Question number 47. Umbilical hernia results from failure of. The right answer is A. Midgut loop retraction. Question number 48. The fetal period of maximum weight gain is. The right answer is A. Last 2 months. Question number 49. The structure connecting atria and fetus is. The right answer is A. Foramen ovale. Question number 50. The pharyngeal pouch forming palatine tonsils is. The right answer is A. Secant.